Our next and final speaker in this particular part of the launch is Eóin Killackey, the head of, and Professor Killackey is the head of functional recovery in youth mental health at Orygen and the Centre for Youth Mental Health at the University of Melbourne. And most recently, he's developed a framework for global youth mental health in collaboration with the World Economic Forum. And Eóin, welcome. And it will be great to hear Orygen's perspective on housing and support.
Thanks, Jenny, and thanks for having me. When you get to be at the end of a list of people like that, I think it's very tempting to just say, what they said and be done with it. But I've got a few other things I might say. I might also start by paying my respects to the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land on which I live. Acknowledge that they've never ceded their sovereignty of this country, and pay my respects to their elders past, present and emerging. At Orygen, we work with young people, and in terms of mental illness, that's really important because we know that 75% of mental illness emerges by the time that people are 25 years old. And a consequence of that is that a number of the important developmental tasks that happen through late adolescence and into early adulthood can often be really compromised. And those are things like, finishing your education, transitioning into employment, and establishing yourself as an independent adult, including, living independently. So if the onset of mental illness can get in the way of these things and cause quite a range of problems. So for young people at the intersection of mental illness and homelessness, one of the problems that I think they confront, and I think Karen just mentioned it, is this idea of silos. And it seems to me that these silos are kind of everywhere, and they must make sense from some sort of top-down kind of place. But they just don't make sense in the lives of young people, or probably any people, because people have multi-domain problems. They don't have these kind of neat problems that fit across these siloed kind of approaches. We know too from a lot of research that there's a bidirectional vulnerability between mental illness and homelessness. We know that people who've experienced mental illness are more likely to experience homelessness and vice versa. But one of the things that we also know is that around about a third of young people who are experiencing mental illness and homelessness are likely to access services. So there's 2/3 who aren't accessing the support, or they're not aware of the support services that they might get. And I think there's a range of reasons for this. Part of it is, I think, the way that we set up mental health services. Quite often, I think these services are set up much more around the needs of staff than they are of the clients who we're meant to be serving. And if you look at a lot of the outpatient services that we have, they're sort of, they work from 9 to 5. One of the things that we do a lot in our work is try to help young people back into school and work. And if we're successful with that, then they can't actually attend their mental health appointments. So we've got to start building services that are centred around the people that we're trying to work with. Similarly, Headspace has been a great initiative across the country, but I think one of the things that's really lacking in the Headspace model is a capacity for outreach to work with young people who won't necessarily come into the centre or who don't even know about the centre. So being able to go out and meet those young people where they are and work with them. And I think that's particularly important for vulnerable communities of young people, whether it's around homelessness, transition from out-of-home care, or other groups like that. I think even in specialist services, we can do a lot better. One of my most earliest memories, and admittedly this was in the last millennia, but one of my most earliest memories as a student doing a placement in a specialist mental health setting was that people were being discharged from the inpatient unit to a caravan park with a couple of nights paid for, but the caravan park was out of area. So after those couple of nights, it'll be another health services problem. And we've got to, long time since I've seen that, but I'm willing to bet that somewhere I could find that same kind of attitude. A number of years ago, we looked at admission accommodation and discharge accommodation for some of the young people coming through our ward. And we found around about 10% of young people being discharged into less secure accommodation than the accommodation that they had come from. And I think one of the things that we could do in this area, quite simply, is to make sure that nobody gets discharged into less secure accommodation than the accommodation that they came from, even if that means that they need to stay, in the hospital for a little bit longer till we find the appropriate accommodation. But the accommodation that we find, particularly for young people, I think has to be secure and long-lasting, because there's a range of developmental tasks that they need to do, whether it's, like I said, around education, employment, learning how to be an independent adult. And the basis for that has to be a secure place to live, as it is, for those of us who are lucky to have had that in our lives. We need to make sure that they have a guarantee that they'll be there for long enough to do these things, whether that's a few months or a few years, and it needs to be a safe kind of, housing first kind of approach. The final thing I'd say is, when I look at the mental health services we have, and particularly those which have got some outreach around homelessness, there doesn't seem to have been a lot of co-design. We're not sitting down with the young people who are experiencing these problems and asking them, what do they need the services to look like, and how do they need the services to perform for them? And I think that a key thing in the development of these things going forward will be a co-design approach with the young people who are experiencing these things. So thank you.
Many thanks, Eóin, and thanks so much for Orygen's involvement, and hopefully we'll continue the relationship. And thanks for pointing to the specific needs of young people and the tailored response that we need for them, and for giving me bidirectional vulnerability. I think I'll be bringing that out again.